We've got 10 minutes for Q&A.
For the last speaker, Lindsay, I was super excited to hear, you have obviously the real solution a lot of people in this room can adopt. As a stage 4 cancer survivor myself, I was curious that you didn't mention dance. And part of the reason is because inspired by my own recovery, I started really do the power of music and dance. I actually started a company called Dance for Healing. And I just graduated from Harvard Medical School, 1 year postgraduate writing, which my literature review paper was analyzing 50 research papers out of 100 research papers that we gathered. Many of them are systematic reviews, particularly in their clinical study validate the benefits of dance. But of course, you can't dance without the music. But I was just kind of curious.
That's a really good suggestion, and I don't know why I didn't think of dance. After this, I'd love to talk to you about that, and I'd love to actually add that to these slides. Because even I have a 2-year-old, and so, even research that you talk about of bringing happiness and wellness is talking about dance and starting your day off with a dance party. And so I think that's a really good suggestion to add. So I thank you.
Yeah, we want to use the mics for the online audience, even that we might be able to hear each other.
I haven't practiced nursing in 5 years, so mine is to the doctor. You mentioned mucositis. What about thrush? Mm-hmm. Because my husband, when I looked in his mouth, the first treatment, he was having a lot of pain. I said, I think you have thrush. Mm-hmm. So when we visited the doctor, he said, oh no, I don't think that's thrush. I said, I've seen thrush. That looks like thrush to me. So is there a difference? I mean, we treated for thrush and it went away. So I think I was right, but anyway.
Yes, thank you so much for bringing that up. And it is really important to think about thrush when someone's having mucositis. Just to clarify, thrush is really a fungal infection that's happening on top of mucositis. And you can be at a greater risk of developing that fungal infection in your mouth when your immune system is suppressed or there's damage to the normal healthy tissues. So after radiation, if getting ongoing chemotherapy, or if using some of the medications, like if you've had to be on steroids, steroids can also suppress your immune system. So we should be thinking about thrush when we're treating mucositis and need to be doing a physical exam and looking in the mouth to see if we see any of the physical findings that come along with thrush. Often we think of as kind of these white-like plaques on the tongue or even on the oral mucosa, like on the cheek or at the top of the mouth. And we will often co-treat with the medications even I talked about. I think about this especially if we're going to use that topical steroid, because you're putting an immune suppressant into the mouth. You will often co-treat for thrush at the same time. So thank you for bringing up that point. It can be a critical part of pain management through treating a super infection, an infection that's actually happening with the fungal. Yeah, thank you.
This is a filler. So in terms of pre-medicating prior to exercise, what are the benefits of that? I had thought it was more of the downstream effect in terms of exercise would generate all this pain and you want to treat it afterwards versus prevent the pain. And if you're taking a pre-med, you might do things that you actually shouldn't be doing to your body. So if you could elaborate on that, that would be great.
Yeah. I agree. You don't want to push your body beyond what your limits are because, again, like I said, if you do too much or too little, it can cause pain. So agreed. You don't want to do beyond what your limits and your capabilities are. But you also want to pre-medicate so you don't have pain as a limiting factor in being able to do your exercise. So as you pre-medicate, you take your medications, it helps kind of ease those pain symptoms so you can get more benefit and more activity.
I might just add too, that's, I think one of the reasons too, Lindsay had brought up physical therapy, because sometimes working with a physical therapist just might help you to also be gauging, this is sort of the range or how many reps. This is sort of what I would recommend to have that incremental increase. So you have some guidance to know too, oh, okay, I'm not gonna totally overdo it if I follow the physical therapy plan.
So I was diagnosed with mucosal melanoma in my nasal passage in May of 2013. So I'm kind of a miracle to still be here. However, after cyberknife radiation in 2019 and this fistula started to open and went inside and blah, blah, I do have chronic pain that I live with. So chronic inflammation causes pain. I've been on ibuprofen because it's an NSAID, and it's what helps. Gabapentin as well. People say, oh, gabapentin, not to worry. I worry about the NSAID though, because now the pain has been pretty bad for 5 years. And I pretty much live on ibuprofen, and I keep, every time I think, oh, I can go backwards, and take less, the pain flares. And I'm trying to go for quality of life, because if I can control the pain better, pain management, I have huge respect for palliative care and anybody who deals with pain management, because it's very much an art and always a moving target. What words of comfort, maybe, or advice do you have for me for now 5 years of being on ibuprofen every day? I don't want to blow out. I mean, I do the things that you have said, right? With food and hydrate. Well, I could do better. But anyway, you have other thoughts on long-term use of ibuprofen and the risks to, heart, lungs, or not lungs, kidney and liver. Yeah, thank you.
Yeah, and I'll invite colleagues to share too their thoughts. But I think kind of back to that pyramid and that arrow on the side, that we're looking at the risk versus the benefits. It sounds like you've had incredible benefit from the daily ibuprofen use, and you have tolerated it for all these years. So with monitoring, I'm sure your doctors are checking your kidney function and your blood pressure and how you're tolerating the medication. And so that goes into that sort of formula of the risk and benefits. So I think it sounds like you've had good benefit and you haven't had a lot of the potential complications that could happen. And so it continues to be potentially a good option. So I think with any medication, even if it's Tylenol or if it's the stronger opioid medications, we're always in this kind of delicate dance between the risk and benefits, and talking with your doctors about your concerns, coming up with an individualized plan for who you are as an individual and how you weigh those risks and benefits. I think that's all part of it. And so these are not, unfortunately, it's not concrete black and white. It really is taking into consideration the individual, the benefits they get, and how they sort of feel about some of the potential side effects and risks, and ongoing monitoring to make sure that we're still on the positive side of that balance.
We probably have time for one more quick question. Perfect.
I was just going to say, I think you're mentioning quality of life is really important, that medication potentially in and of itself has increased your quality of life. We like to think of ourselves as quality of life specialists. And so I would hone in on that and say to yourself or to others, what are the long-term risks of having a low quality of life? And has ibuprofen provided that high quality for you?
I have the microphone. I was wondering if low-dose naltrexone has any benefit in pain control and quality of life.
Yeah, I've looked into this at some point, and I think there might be a little bit of data, but I'd have to brush up on sort of what the latest is. That is, I would say, probably more of like an emerging area that's still being studied more for, and I've seen that more for kind of chronic pain to try a low dose to see if that can be helpful as as an alternative or a potentially safer alternative to, for example, full agonist regular opioid medicines? I think it's another good point about how pain management, I think, can be so individualized for what works for someone, how we think about that balance of quality of life and the benefits it's providing. Thanks for bringing that up.
All right, thank you all so much for your wonderful presentations, and we're going to move along.